Okay, so hello everyone, thank you for having me. My name is Nicole Abdullah. I am from Faculdades Pequeno Príncipe, Curitiba, Brazil, and today I'm going to present to you guys my systematic review called Mechanisms of SARS-CoV-2 neurovirulence and chemosensory dysfunction and prognosis of affection patients. A little summary, we're going to talk a little bit in the introduction, objectives, methods, results, talk a little bit about the prisma was made, discussion, conclusion, acknowledgements, and then references. So in the beginning, let's talk a little bit about the SARS-CoV-2. This is a very acute respiratory syndrome caused by COVID-19. It was first elucidated in January of 2020 in China, Wuhan, following the cases of pneumonia of unknown origin. The clinical presentation of the COVID-19 is very, it varies in the symptom duration, severity, and complication. It's very important to illustrate that this disease, the COVID-19 disease, is a multi-symptomatic disease, especially because of the AC2 tropism of the coronavirus. So it will affect the lungs, kidney, muscle cells, neuroepithelium, substance nigrans, and a lot of other parts of the body. And also, it's very important to illustrate the post-COVID syndrome, which is the development of new symptoms after the initial SARS-CoV-2, lasting for more than 3 months. It's important to demonstrate this one because the olfactory injuries that we're going to see is very correlated with the post-COVID syndrome. So talking about the main hypothesis of SARS-CoV-2 and olfactory injuries, the most two symptoms that is associated is the loss of smell and loss of taste, so anosmia and nausea. The main hypothesis is the destruction of nasal epithelium, direct injury to olfactory receptor neurons, the arms. We will talk about the cells a little bit forward, and of course the inflammatory cascade. And in these patients, quality of life is very affected due to the olfactory and gustatory stimuli means the warning of intake, contaminated poison and food, but not just about the food or the fire or the gas, but also is very stimulating of dopamine and related also to limbic system. So we will see in these individuals not only the nutrition affected, but also social withdrawal and the development of depression, anxiety, and even some food disorders. So the aim of this study is to identify the neurovirulence mechanisms related to chemosensory dysfunction on SARS-CoV-2 patients, and also how the remission of these olfactory symptoms and their prognosis will develop in these individuals. So it was conducted a systematic review of literature with the main question being the neurosensorial dysfunction and the prognosis of the patients. We use it as databases, the PubMed, VHS, the Medline, Lilacs, and Sirens Direct, using the following strategy only. So all of the descriptors were consulted in DAX and MASH, and the article was developed especially in PRISMA 2020 checklist. We have inclusion criteria and exclusion criteria. Basically, the inclusion criteria is basically all of the articles that it was defined matching the same objectives of the research question, and also well-delineated research questions and methodology. Publication, of course, 2020 forward. Exclusion criteria was related to reviews of all type, not related to the proposed agenda, articles not published in English, opinion articles, and especially the articles who the structure is not scientifically correct. This is our PRISMA, so it was made 326 studies were identified and 13 studies were included with all of the exclusion and inclusion criteria, eligibility, and all of all of the criteria already cited. So let's talk a little bit about the conclusion. I'm sorry, the discussion. So mechanisms associated with development of anosmia and analgesia. We have the main damage, which is the cytokine storms by IL-6, TNF-alpha, IL-1, and infiltrated cells. And with these cytokine storms will cause the destruction of olfactory receptors neurons. This main damage occurs after the binding of the virus in the first entry of SARS-CoV-2 in olfactory epithelium, which is by the AC2. I already talked about this receptor is very important because it's also associated with algesia. And also nasal epithelium cells as sustentacular cells. They're also the binding mechanism for this, the first entry, the first door of the SARS-CoV-2 in the neuroepithelium. In algesia, on the other hand, we have AC2 receptor in tongue and oral mucosa. We will have some disturbance in ion channels and in salivary components. So it's major the explanation why the loss of taste will happen. It's important to associate that the flavor, it's the loss, it's also affected because of the loss of smell and the loss of taste, and the flavor is taste and smell, so it's all associated. We have the role of EL6, that's why I talked about the flavor also. The EL6 will act as an endogenous substance that regulates the olfactory function, and we will act especially only in peripheral and central aspects of the body, and will intermediate the anosmia and algesia. That's why a lot of the patients who have anosmia will also have algesia. We have here in 65% of people will have both, and only 8% will have one. Histopathological findings were also very important. We saw in hamsters some leukocyte infiltration in lamina propria, as well as focal atrophy and olfactory mucosa. And it's very important in persistent anosmia post-COVID syndrome. We have mild chronic inflammation and a massive dispersion of olfactory bulb. Prognosis. In general, the prognosis of the loss of smell, loss of taste is a good one. It will do the remission in 1 or 2 weeks, but usually it's more frequent, the persistence of the symptoms in young female patients between 20 and 30 years, and also patients who have a history of olfactory dysfunction as rhinitis or chronic sinusitis. Male patients who had faster symptoms remission. It's important to differentiate these two gender aspects to make a forward research about. So the severity associated with anosmia, actually, the patients who had anosmia didn't have a lot of severity associated, and in the ICU, the only people who were admitted was the ones associated with dyspnea, high respiratory rate, fever, and expectoration. Also, association between anosmia and intensive care is very related to lower definitive airway introduction. So these people indeed have a better, not that severe cases of COVID-19. About the sequelae, like I said, the perception is stored in 1 or 2 weeks, especially because of the differentiation of progenitor cells into mature horns. But this regeneration can take long to achieve a complex and complete neural development. And in these cases, it's important in early stages of the disease, it started with corticosteroids therapy. It's not the aim of our project, but I will show you guys more forward how we can help the situation. We have a lot of criteria to use it, and I also saw some studies that didn't like the use of corticosteroids, systemic or topical in this subject, but it might help with the sequelae. So also we have the 99 of 214 patients recovering for severe COVID-19 after 6 weeks of analysis. So the post-COVID syndrome is very related in the situations, and the persistence of anosmia was reported in 16.7% of these cases. Obesity is very associated also with symptom severity and persistence. About the quality of life in these patients, so the nutritional status, like I said, it was very influenced also by depression, anxiety, social isolation, and severe eating disorders such as anorexia. And like we was previously shown, that anosmia and analgesia are among the most common symptoms persisting after the acute phase of the disease. So the approach of a longitudinal and indefinite multidisciplinary support is very important in these patients, because not only we can help them with medicaments, but also with a psychological aspects, because the more the organs will take to regenerate, more chances we have to the symptoms be ad eternum. So it's very important, this multidisciplinary support. Like I said about the treatment, so it was said that it helps, but only in the early stages. We can use for 14 days. And it helps, especially because of the horns. But like I also said, it's very divergent situation. And of course, a lot of articles was also hinting a lot about the importance of long-term following up in phases on these patients. So in conclusion, the AC2 activity and injury of the olfactory bulb are triggered by the inflammatory cascade and pro-inflammatory cytokinins. It was the main damage that occurs to the anosmia and analgesia. We also have gustatory alterations, results for disturbances in iron channel, especially in IC2 receptors on tongue and salicylic acid receptors, which is a salivary component. And of course, the prognosis of the COVID-19 will also depend, of course, in the patient's comorbidities, but those who have present anosmia and analgesia early might have a better prognosis. Also, loss of smell is associated with better prognosis and less severity, but it's one of the most common PCS symptoms. Statements and declaration, we have nothing to declare, no funds, grants, or financial or non-financial interests. This is our references, and thank you so much for your attention.